If we're looking at skin technology, innovation is key, especially in cosmetic dermatology and medical wellness. And what we're seeing is that there's new devices, new technologies coming out all the time. When we're looking at these technologies, we have to go behind evidence-based medicine. And fundamentally, if you're going to show me a cartoon character with the cells growing and saying that this is how it increases, that's not correct for me. What we want to see is we want to see the end output of the cell under histopathological slide, i.e. looking under the slide to see that the cell has thickened, or there is cellular renewal, or we have the output that has been described. So when we're looking at skin tech modalities, we have to look at the end cell that it's affecting, the output, what it's like immediate, what it's like in a year's time, what it's like in 2 to 3 years' time, what it's like in 5 years' time. The prognosis of that skin technology is key in determining whether we bring this modality on or not. Now, when it comes to technologies, what you're looking at is epidermis, dermis, and hypodermis, and sometimes subcut as well. And when you're looking at the skin, you're looking at two factors over here. Firstly, you're looking at endometrial growth factor. So this onboarding or this upregulation will result in cellular turnover and cellular renewal. So thicker, brighter, tighter skin. And then you're also looking at fibroblast upregulation, because fibroblast degradation or degeneration happens from the age of 20 already. So you're already aging. So the key thing about the fibroblasts is they're building blocks of the cells. They produce collagen, elastin, hyaluronic acid, and GAGs. So you want this to be upregulated. You want it to continue to produce because it will produce tighter, firmer skin, more hydrated skin. It will reduce open pores, oiliness, fine lines. It will reduce pigmentation, even skin tone. It reduces inflammation. So if your acneic breakouts, your rosacea breakout. So these are the two factors we want to work on when we're looking at skin technology. In terms of the technologies, if we go back to the epidermis and the dermis, the kind of technologies we're looking at is chemical peels, then you've got mesotherapy, then you've got prescription grade microneedling, then you've got LED therapy, then you've also got cosmeceuticals. So if we look at chemical peels, this is controlled trauma, and they tend to sit on the epidermis and the dermis, and it causes cellular renewal and cellular turnover. The kind of acids that are used in this kind of aspect is your kojic, your lactic, your salicylic, you've got phenol peels, TCA peels. This is quite an old school approach that's not commonly used anymore, but you can use it. You can use a combination of glycolic with salicylic for your acne, or your phenol and your TCA for sun damage, because what it does, it creates controlled trauma at an epidermal and dermal layer, working on fibroblast stimulation and also the endometrial growth factor. So in effect, it improves your fine lines, your wrinkles, your open pores. It can brighten and tighten your skin. When we're looking at something like mesotherapy, this is injected into the mesoderm. So what you're injecting is things like hyaluronic acid, growth factors, vitamins, minerals, amino acids. This will be used not just for skin, but it can also be used for hair renewal as well. And then when we're looking at prescription grade microneedling, you're looking at controlled trauma or controlled channels going down from the epidermis to the dermis with little microchannels, which in turn will result in collagen upregulation or fibroblast stimulation. You're getting upregulation of your GAGs, your hyaluronic acid, your collagen, and your elastin, which means you're going to get tighter, brighter, firm skin, which can help with scar renewal, open pores, oiliness, laxity, fine lines and wrinkles, and then also you're getting cellular renewal. But the key thing about prescription grade microneedling is the microchannels that it creates, or the microtrauma that it creates. It allows prescription grade cosmeceuticals or dermaceuticals to penetrate deep into the dermis, which can then work on the cells that we need to work on, such as the melanocytes or the fibroblasts, to give you the outcome you want. Then we have cosmeceuticals, which tend to be over the counter, and it's all dependent upon the carrier systems. Cosmeceuticals can be ingredients such as vitamin A derivatives, such as your retinols and your retinals. And then you've also got your antioxidants, such as your vitamin C, your vitamin E, you've got your peptides, your growth factors, all the fun stuff that you see in key ingredients. But the key thing here is formulation. Does it get to the end cell that you need it to get to? Does it get to the medical layer? Is it active and concentrated enough? So this, you have to look at the formulation in terms of cosmeceuticals and the endpoint and the end result. And there's also LED therapy, so red light therapy, that can be used for collagen induction, so you see reduction in fine lines and wrinkles, and you feel a little bit brighter.